We will be talking about microbial diseases of the respiratory system. First is pharyngitis. Pharyngitis is inflammation of the mucous membranes of the throat or sore throat. It is usually caused by viral and/or bacterial infections, such as the common cold and flu, both viral infections, or by infection with the Streptococcus bacterium. It can also occur with mono or viral infection. Symptoms of pharyngitis are sore throat, dry, scratchy throat, pain when swallowing, or pain when speaking. Other symptoms may be present depending on the cause. These include fatigue, muscle aches, headache, and fever, especially with the flu or other viral infections. The treatment depends on the cause. Viral pharyngitis goes away on its own with salt gargles, pain relievers, and extra fluids to help alleviate the symptoms. Bacterial pharyngitis is treated with antibiotics, and fungal pharyngitis is treated with antifungal medications. And this is the difference between bacterial pharyngitis and viral pharyngitis, the symptoms between them. And then this is a diagnosis chart of 1,000 children and their ages. And this is a picture of ulcerative pharyngitis. And then this is the difference between streptococcal pharyngitis and viral pharyngitis. Next is laryngitis, and you can see that these are the normal vocal cords, and these are when they're inflamed vocal cords. Laryngitis is an inflammation of your voice box from overuse, irritation, or infection. Inside the larynx are your vocal cords, two folds of mucous membrane covering muscles and cartilage. Normally, your vocal cords open and close smoothly, forming sounds through their movement and vibration. But with laryngitis, your vocal cords become inflamed or irritated. This swelling causes distortion of the sounds produced by air passing over them. As a result, your voice sounds hoarse. In some cases of laryngitis, your voice can become almost undetectable. Laryngitis may be short-lived, which is acute, or long-lasting, which is chronic. Most cases of laryngitis are triggered by a temporary viral infection or vocal strain and aren't serious. Persistent hoarseness can sometimes signal a more serious underlying medical condition. And then here's a video about laryngitis.
Pizza or salad? Which one do you think I'm having for dinner tonight? Well,
the larynx is located between the back of the throat and the trachea. Inside the larynx are the vocal cords. When the vocal cords become inflamed or irritated, the larynx also becomes inflamed. Inflammation of the larynx or voice box is known as laryngitis or sore throat. Inflammation of the larynx causes the voice to sound hoarse. It may sound rough, deeper than it used to, or cause the loss of the voice. There are two types of laryngitis, namely acute laryngitis and chronic laryngitis. Acute laryngitis is usually a self-limited disease which heals quickly. The possible causes of acute laryngitis may be viral infection, similar to the one that causes colds, overuse of the vocal cords, and bacterial infection. Chronic laryngitis is laryngitis that lasts for more than 3 weeks. It is most commonly caused by irritants such as dust, allergens, smoke, and chemical fumes. Chronic laryngitis may also be due to acid reflux, nasal problems and sinusitis, nerve damage, nodules or lumps of the vocal cords, smoking, or excessive alcohol drinking. Laryngitis often resolves on its own without treatment. The best remedy for acute laryngitis is healthy lifestyle, which strengthens the immune system. If laryngitis persists, antibiotics are sometimes needed. Here are a few precautions to prevent laryngitis. Don't strain while speaking. Humidify the air you breathe. Don't smoke. Quit smoking and stay away from smokers. Drink plenty of water. Abstain from clearing your throat frequently, as it causes swelling of the larynx. Get your annual flu shot, and avoid contact with people who have colds or any other respiratory infection. Your general practitioner can give you more information about the disorder and its possible treatments.
Okay. Symptoms of laryngitis. In most cases, laryngitis symptoms last less than a couple of weeks and are caused by something minor, such as a virus. Less often, laryngitis symptoms are caused by something more serious or long-lasting. Laryngitis signs and symptoms include hoarseness, weak voice or voice loss, tickling sensation and rawness of your throat, sore throat, dry throat, or dry cough. Causes of laryngitis. Most cases of laryngitis are temporary and improve after the underlying cause gets better. Causes of acute laryngitis include viral infections similar to those that cause a cold, vocal strain caused by yelling or overusing your voice, bacterial infections such as diphtheria, also this is rare in large part due to increasing rates of vaccination. Chronic laryngitis. Laryngitis that lasts longer than 3 weeks is known as chronic laryngitis. This type of laryngitis is generally caused by exposure to irritants over time. Chronic laryngitis can cause vocal cord strain and injuries or growths on the vocal cords. And then this is laryngitis cases per year. And how to relieve pharyngitis. Use cough suppressant, avoid smoking, try a cool mist humidifier, and take over-the-counter pain medications. Other causes of chronic hoarseness include cancer, vocal cord paralysis, which can result from injury, a stroke, a lung tumor, or other health conditions. Bowing of the vocal cords in old age. Risk factors for laryngitis include having a respiratory infection such as a cold, bronchitis, or sinuses, exposure to irritating substances such as cigarette smoke, excessive alcohol intake, stomach acid, or workplace chemicals, overusing your voice by speaking too much, speaking too loudly, shouting, or singing. And then prevention of laryngitis. Don't smoke and avoid secondhand smoke. Limit alcohol and caffeine. Drink plenty of water. Avoid eating spicy foods. Include whole grains, fruits, and vegetables in your diet, and avoid clearing your throat. Okay. And then that's a picture of bacterial laryngitis. Swollen uvula, red swollen tonsils, gray fairy tongue, whitish spots, and throat redness. Tonsillitis. Tonsillitis is inflammation of the tonsils. 2 oval-shaped pads of tissue at the back of the throat, 1 tonsil on each side. Signs and symptoms of tonsillitis include swollen tonsils, sore throat, difficulty swallowing, and tender lymph nodes on the sides of the neck. Most cases of tonsillitis are caused by infection with a common virus, but bacterial infections also may cause tonsillitis. Because appropriate treatment for tonsillitis depends on the cause, it's important to get a prompt and accurate diagnosis. Surgery to remove tonsils, once a common procedure to treat tonsillitis, is usually performed only when bacterial tonsillitis occurs frequently, doesn't respond to other treatments, or causes serious complications. And then there's another picture of how the tonsils are swollen. And then these are the different things they can do with the tonsils. And then symptoms of tonsillitis. Tonsillitis most commonly affects children between preschool ages and the mid-teenage years. Common signs and symptoms of tonsillitis include red swollen tonsils, white or yellow coating or patches on the tonsils, sore throat, difficult or painful swallowing, fever, enlarged tender glands in the neck, a scratchy, muffled, or throaty voice, bad breath, stomach ache, particularly in younger children, stiff neck, headache. In young children who are unable to describe how they feel, signs of tonsillitis may include drooling due to difficult or painful swallowing, refusal to eat, or unusual fussiness. And then here is causes of tonsillitis. Causes. Tonsillitis is most often caused by common viruses, but bacterial infections can also be the cause. The most common bacterium causing tonsillitis is Streptococcus pyogenes, the bacterium that causes strep throat. Other strains of strep and other bacteria also may cause tonsillitis. Why do tonsils get infected? The tonsils are the immune system's first line of defense and against bacteria and viruses that enter your mouth. This function may make the tonsils particularly vulnerable to infection and inflammation. However, the tonsil's immune system function declines after puberty, a factor that may account for the rare cases of tonsillitis in adults. Okay. And this is a tonsillectomy graph of how many surgeries they did. Next is epiglottitis. Epiglottitis is a potentially life-threatening condition that occurs when the epiglottis, a small cartilage lid that covers your windpipe, swells, blocking the flow of air into your lungs. A number of factors can cause the epiglottis to swell. Burns from hot liquids, direct injury to your throat, and various infections. The most common cause of epiglottitis in children in the past was infection with influenza type B, the same bacterium that causes pneumonia, meningitis, and infections in the bloodstream. Epiglottitis can occur at any age. Routine HIV vaccination for infants has made epiglottitis rare, but the condition remains a concern. And then there's a epiglottitis x-ray, as you can see right there. And that's an epiglottitis diagnosis graph of each year. And that's acute epiglottitis. The symptoms of epiglottitis include fever, severe sore throat, abnormal, high-pitched sound when breathing, difficult and painful swallowing, drooling, anxious, restless behavior, and feeling better when sitting up or leaning forward. And those are symptoms in children. Symptoms in adults include fever, a muffled or hoarse voice, abnormal, high-pitched sound when breathing, difficulty swallowing, and drooling. And then causes. Epiglottitis is caused by an infection or an injury. Okay. Next is streptococcal pharyngitis, which is strep throat. Strep throat is a bacterial infection that can make your throat feel sore and scratchy. Strep throat accounts for only a small portion of sore throats. If untreated, strep throat can cause complications such as kidney inflammation or rheumatic fever. Rheumatic fever can lead to painful and inflamed joints, a specific type of rash, or heart valve damage. Strep throat is most common in children, but it affects people of all ages. And then here's a video on strep throat.
We are being censored. America's news outlets no longer provide the truth. I'm Joshua Phillip.
Today's topic is streptococcal pharyngitis. Streptococcal pharyngitis is a contagious disease characterized by the inflammation or swelling and pain of the mucous membrane lining the back of the throat, including tonsils. Also known as strep throat, streptococcal pharyngitis accounts for a small portion of a sore throat. If left untreated, it can result in complications, such as kidney inflammation or rheumatic fever. Streptococcal pharyngitis affects people of all ages, but is more prevalent in children, especially those between the ages of 5 and 15. This is because their body has not built up immunity to many of the viruses and bacteria. Streptococcal pharyngitis occurs mostly between late fall and early spring. Causes. Streptococcal pharyngitis is caused by Group A Streptococcus bacteria. This bacteria are extremely contagious and can be spread directly from person to person or by touching an infected surface, such as doorknobs, bathroom objects, utensils, and then touching the mouth, eyes, or nose. They can spread through airborne droplets when an infected individual coughs or sneezes, or through shared food or drinks. The rate of transmission is increased whenever groups of people are in close contacts, such as in schools and military. Symptoms. Symptoms begin 1 or 3 days after exposure and last 7 to 10 days. Painful swallowing, fever, a headache, rash, body aches, nausea and vomiting, especially in children, pain in the throat, loss of appetite, swollen lymph nodes in the neck, red and swollen tonsils with pus. Diagnosis. The doctor will examine the patient, look for signs and symptoms of streptococcal pharyngitis or throat infection. There are 2 common tests used in making a diagnosis. Rapid test. Your doctor collects sample by swabbing the back of your throat with a long cotton swab, and then sends the sample to the lab to check for signs of bacteria. The turnaround time for the test is usually around 10 minutes. If the result comes in negative, a throat culture may be done to confirm a diagnosis. A swab is rubbed against the back of the throat and tonsils. The sample of the secretion gotten is cultured in a laboratory for the presence of bacteria. Results can take more than a day. Treatment. Medications are available to cure streptococcal pharyngitis, prevent its complication, and relieve pain. If diagnosis confirms the presence of the bacteria, your doctor will prescribe antibiotics to resolve your infection. Antibiotics taken within 48 hours of onset of your illness will help reduce duration and severity of your symptoms and the likelihood of the infection spreading to others. It is important that you finish your antibiotics course to kill the infection completely and prevent relapse. To relieve pain and reduce fever, pain relief such as ibuprofen or acetaminophen or paracetamol may be used. Some lifestyle and home remedies may help resolve symptoms of your infection. This may include rest, drinking plenty of fluids, turning on a cool mist humidifier. Salt water gargles several times a day can help relieve symptoms. Throat lozenges. To prevent infection, clean your hands regularly and don't share personal stuffs. Thank you for watching our video. Please do not forget to like and share the video.
Okay. So this is showing the scale they use. And then 4, you have treatment with antibiotics. Signs and symptoms of strep throat. Throat pain that usually comes on quickly, painful swallowing, red and swollen tonsils, sometimes with white patches or streaks of pus, tiny red spots on the area at the back of the roof of the mouth, swollen, tender lymph nodes in your neck, fever, headache, rash, nausea or vomiting, especially in younger children, body aches. And there is a rash you could get also. Causes of the strep throat is bacteria known as Streptococcus pyogenes, also known as Group A Streptococcus. Streptococcal bacteria are highly contagious. They can spread through airborne droplets when someone with the infection coughs or sneezes, or through shared foods or drinks. You can also pick up bacteria from a doorknob or other surface and transfer them to your nose, mouth, or eyes.